Jess, so she's gonna help. So we're gonna play a game of telephone, but with earplugs. Okay. So if you guys wanna form two lines, kind of down the middle here. So this half that wants to get up.
ENTs.
Hand up earplugs.
That
Make sure you really.
ENT is ear, nose, and throat.
Are we putting them on? Yep, you're gonna put the earplugs in. So really, you get them, open them up. Make them really skinny.
So we gotta twist the end?
Push them in, yeah. Twist them and really shove them in.
Shove them in.
Pass them down.
I get it? Hey, sort of spin it, twist it.
Did everybody get one? Is that an extra? There we go. Everybody get one?
So everyone knows what it is? Push it. Couple of your ears. Shove it in.
We're using tiny tools. We're using tiny tools.
You guys wanna? Well, we can either form two lines, otherwise we can just kind of do that. Alright, we'll start with you. So Jess is gonna show you the sentence. Jess will show the first person the sentence. Then just everyone's played telephone before, right? So just kind of snake around, and then the last person in the back will tell us what she said. Oh no, we can do two.
You gotta twist it like really hard. Like what? I'm saying, stop. Excuse me. Just climb. What? You make my head hurt. Are we starting? Yeah.
You like the sound of the wind blowing through your ears?
Sure. I just don't like whatever. Where is there two? That's a country.
Steve, what do you think? He's got to put his earplugs in. He's got to put his earplugs in. What have you been doing?
Playing telephone. Have you never?
No, I guess not. She's going to tell you something.
She's gonna tell you something. You have to figure out what it is.
You've never played telephone?
And then you're always gonna tell me.
What?
Wait, what?
You whispered.
Yeah, whisper
Yeah.
whatever the last person told you.
What?
Yeah, she did that.
Yeah, she's doing it.
Just go one time.
You can't talk loud when they're asking you. Tell her what you just said. Quiet. Tell them again.
Really? Yeah. Are you serious? Oh my gosh, shoot. I don't know why you wanted
Alright. So what did you guys have?
Biology requires 4 years of college.
Close. What did, I mean, very, very close. What was yours?
somebody weird.
That's weird.
Okay, yeah. So audiology requires a 4-year doctorate degree. So you were super, super close.
Oh, we won.
Wow. Yay, you
How
don't
did
win
we get
anything.
somebody's beer?
I heard somebody told me, I'm not gonna say which one.
It's required.
But it was something about hearing. Literally what he told me, and I told him.
That's what I was told. Something about hearing. Yeah. See?
Alright, here we go.
Wait, what was it actually?
Just what I read. So audiology requires a 4-year doctorate degree.
Oh, you said that.
Yeah.
I read somebody like, I can't remember
So
that.
how,
Something about
you guys have
hearing.
played telephone before. How was that different? Can't hear. Was it, how did it make you feel?
I did not like it. I didn't like the cases in my new wall.
So kind of uncomfortable? Maybe a little nervous? A little frustrated? I mean, this is a little, I mean, it was a game, it was fun, but you didn't want to say the wrong thing, right? So that's what I deal with. Patients that come see me, most of the time, they can't hear. You know, and it can be babies, it can be adults. You know, now it's affecting, you know, think about if you had earplugs in, well, you couldn't hear like you couldn't there, now you're trying to listen in the classroom. You know, you're trying to go out and communicate in the environment, you know, you go to a restaurant, and a waitress is asking something, and you're what? What? How often do you want to say what? Right, how would that make you feel? Would you kind of stop going out? Or just nod? Okay, so that's kind of where I'm coming from, that's what I deal with on a daily basis. So, what we're going to kind of talk about today, you know, what is audiology? What do I do? The education? Where can I work? What's my typical day like? Great personality traits for this, benefits and questions. But I really I like more of a casual approach. So if you guys have questions throughout, even if it's not related to my slide, if something pops up, if you're like me, if you don't ask right away, I forget it 2 minutes later. So please raise your hand, interrupt. More questions, the better. It'll be more fun for you and fun for me. All right, so what is audiology? Audiology is the evaluation and treatment of hearing and balance disorders. So as an audiologist, I'm a hearing and balance specialist. Okay, so people come not only for hearing concerns, but also dizzy. people that, kind of feel like they want to tilt-a-whirl and they can't get off, loss of balance, people that, need assistance walking and it happens suddenly, they don't know why. So I evaluate and treat that as well. So when you think about allergy, you probably think headphones, raising your hand for beeps. That is a big thing, a component of what we do to test hearing. Who here has had a hearing test before? Good. It's a great idea, you're gonna graduate from high school, you're gonna go off to college, let's get a hearing test. And then if you have normal hearing, every 5 to 10 years up until you're age 50. Once you're 50, then every 2 to 3 years after that. We like a baseline because you can have a sudden onset hearing loss. So you can have a virus that attacks you, or all of a sudden you wake up one morning and you can't hear out of one ear. You have a baseline somewhere, now we can compare, did you have normal hearing before? Or is it, are we not, or did you have a loss and now it's just a little bit worse? So it helps treatment. So what we do for an eval, we determine the degree, the type, and the configuration of the hearing. So different shapes. So here's a graph, how we graph it. This is a typical what an adult or somebody that, shoots firearms, is a hunter, or listens to loud music, has their stereo cranked all the time in their car, rides motorcycles without hearing protection. Oftentimes this is what we're going to see. Sometimes if it's a genetic hearing loss, you can have it where it's low and then it rises, or sometimes it looks kind of like you took a bite out of a cookie. So depending on the shape too can kind of help us determine what's causing that hearing loss. How the patient responds, either beeps, or we present beeps and they respond oftentimes raising hand, sometimes pushing buttons. Sometimes if they can't, they don't have that capability, they can say beep, whatever. However, we can get sometimes it's eye blinks for patients that are nonverbal. We use this type of test for kiddos that are ages 4 and up. Below that, we have other methods to test. So I do what's something that's called an auditory brainstem response test. So this is pretty cool. I'm able to actually put electrodes on and measure brain waves to determine if somebody can hear. This test, we sometimes go in the OR and we do it sedated. So an anesthesiologist knocks them out, and we take a nice nap and I can measure brain waves that way. Or we can do it while they're awake. This is a gold standard for universal newborn hearing screenings. Who here knew every baby that's born in the United States right now needs to have, or is screened before they leave the hospital? You guys know that? It's something new. You guys are probably around, yeah, right around that time you were born, might have been a little after, it's probably close. They started adopting this from state to state. This is great because now if you get flagged, you have to come see me within the first month of life. If we test and you don't pass within 3 months, we do a full diagnostic hearing test. And if the baby is found to have a permanent hearing loss, then they need hearing aids by age 6 months. That's our golden standard, the 136. So we identify a ton of babies now that have hearing loss, and a lot of babies are wearing hearing aids. Whether that's, which is great because before then, a lot of our kiddos, they wouldn't have been identified until kindergarten. Well, by that point, your speech is delayed, you're delayed in school, so we're really trying, if we hit them by 6 months of age, their speech to develop normally, which is
a lot of
really
that lifelong, or is it just phase?
Most of them is permanent hearing loss. Sometimes you can have ear malformations that at age 6 or 7 can be reconstructed for surgery, and then maybe they have normal hearing underneath. But majority of it is congenital sensory hearing loss. Things like alcohol use in utero, drug use in utero. There's premature births, having to stay in the NICU for greater than 5 days puts you at a higher risk. Jaundice, needing a blood transfusion, that can put you at high risk for developing that. If the mom gets an infection, CMV, acetomegavirus, is a huge one, and it affects a lot of women because you get it by touching urine, which sounds disgusting, but daycare providers. A lot of daycare providers will get it because think about it, you're changing diapers all day long and you try to wash your hands, but babies and toddlers are messy and kind of gross sometimes. So that's the most common way. Or if you have other younger children at home, they like to say you wash your hands after everyone, but man, when you get multiple kids and you running around, I mean, there's just times where that's not on the to-do list because one's gonna jump off a chair and whatever. So, anyway, sedimentovirus is a huge one, and that one, sometimes babies aren't born with it, and that's a late onset. So there's sometimes where they're identified later on in life. But we do that. We also can detect if there's a lesion in the auditory pathway. So if they have something like an acoustic neuroma or a non-cancerous growth on the hearing nerve, you know, we can do this test, and some of these waves, if they have it, are going to disappear. We can also identify if they have auditory neuropathy. So sometimes the hearing organ's working normally, those nerves don't fire in sync, and so what's hitting the brain is garbled mess. So we're able to identify that too. So a nasty diagnosis, but there's ways we can try to help that person.
So what are you looking for in those waves?
Yeah, so these are brain waves. So right now, a patient would have had electrodes, 2 here, 1 behind each ear, and we had a headphone presenting different frequencies of sound at different levels. And these are brain waves, meaning that they are hearing that sound. So every wave, the 1, 3, and 5, is coming from a different part of the auditory pathway. So if some of these waves are absent, we can then know, okay, that growth or that lesion is occurring on, you know, the acoustic nerve or on, you know, farther up. So. And once these waves disappear, we know they're not hearing it. So, so like this one. What did you do it?
Are you touching it, Melissa?
Oh, maybe, I don't know. Okay, so here it's 70, so there's a wave 5. At 60, there is no wave 5 present. It's not repeatable, which means this person would have a moderately severe hearing loss, is how we kind of determine. So this is an estimation, and we estimate hearing loss, and then we can program hearing aids off of these brain waves. So, it's cool. And then we have thank you. Autoacoustic emission. So we measure the function of the outer hair cells. So in the inner ear, it looks like a snail shell. If you guys have taken anatomy, and there's hair cells in there that detect sound. That's how we hear. We damage those hair cells, maybe some medicine, ototoxic medication like chemotherapies, noise, you know, of using your ears without hearing protection. Those hair cells can break off and die. When we measure this, it's an objective test. We basically put headphones in, we present a series of sounds, and the outer hair cells, if they're working normally, they are able to produce an echo that we can record, which is echo here and the noise source down here. So we look for a good separation. If the hair cells are not functioning or they're damaged, then these lines overlap where the top line, that's the one that's supposed to be on top, is below, which means that more likely than not, there's a hearing loss present. So we, and this can show damage before it even shows up in audiogram. So when we see somebody like receiving chemotherapy or head and neck radiation, we always do this test in conjunction with the standard hearing test monitor, because we can see abnormalities that we need to really monitor you because hearing loss is probably formed. This is another one we do on our kiddos. It's kind of like a screener to say, you know, are the hair cells working normally or not? But some hospitals do this as their only test, which this would not pick up auditory neuropathy. So there are potentially babies out there that are passing newborn hearing screenings with this that we will later identify have auditory neuropathy. So that's the one downfall of this test. But then I do a video on nystagmography. So this is balance. Okay, this allows us to test both central, so brain, brainstem, and inner ear, to try to determine what is causing this person to be dizzy. Anybody have or heard of vertigo? Okay, vertigo, basically you have the sensation you're spinning, or the world is spinning around you, and you can't stop it. Sometimes you can have it where you turn a certain way and get dizzy for a couple seconds, or a minute or two, and it stops. You've got crystals in your inner ear that can get dislodged. I can do a thing called the Appling maneuver that gets those crystals back, and you feel better. Sometimes you get a viral infection where you are sicker than a dog for sometimes weeks. Puking in bed, you can't function, and that sometimes wipes out your balance system, so then you're walking like you've had too many, which none of you guys have had, right? Okay. So we measure nothing. Tough crowd. All right. So we eye movements with big infrared goggles, and based on eye movements, we can determine to, like, sometimes your eyes circle, sometimes go back and forth, so we can really monitor that to see what's going on as well. We also evaluate and manage tinnitus. Anybody here have noises in their ears, like ringing, buzzing, humming, swishing? Yeah? That's tinnitus, okay? So you, it's many causes. Sometimes there's wax butting up against the eardrum. Sometimes there's fluid behind the eardrum. Sometimes there's problems with middle ear bones. That's best case scenario, because we can take care of that. Most common causes, though, some medications will give you a side effect of ringing. Often, if you lower the dose, it'll go away or remove the medication. But if blood pressure meds or something, you need them, you know, so you just kind of deal with the ringing. But hearing loss is the #1 cause of ringing. Once you have it, if that's the cause, there's no way to get rid of it. So really, guys, hearing protection, like the earplugs that I gave you are great. If you're going to go to a concert, there was a study, if you stand next to the speakers at a concert, in 7 minutes you have permanent hearing loss. Okay, so you're going to hear the concert just fine. You don't have to wear the big muffs. The big muffs are great, but you're going to hear the music, you know, loud and clear, even with earplugs in. Protect your ears, because once you lose your hearing, aren't getting it back. If you get ringing, I mean, we have people that are debilitating. Because for those of you that have it, you know, hopefully it comes and goes and you can ignore it and you notice it maybe when it's quiet, but otherwise fans or something can ignore it, but it can get loud and get debilitating. But we evaluate using pitch matching, minimal masking level, and the loudness level. And then we try, sometimes hearing aids are enough to help mask it if you have a hearing loss associated with it, because you're hearing so many more sounds. Otherwise, habituation, or there's a notch therapy. We try to like create a sound where that pitch is to try to get you to be able to kind of forget about it, or kind of get your brain to kind of tune it out. So.
Melissa, we have a neighbor who has constant like music in her ears.
Yeah.
That's a real thing?
Yeah.
Like, I mean, when she first told us, we were like,
Yep.
really? She knows the song, like it's
Yep.
the same song?
Yep,
Over
I had a
and over.
patient that said, like choir, like singing.
Yes.
And at first I was like,
Yeah, exactly.
but it is a thing. Yep, yep, so hopefully it's a song you like.
Yeah.
But yeah, you know, ringing, buzzing, humming, swishing. If you ever get a pulsing in your ear, and if it's going literally with your pulse, that's not normal. Go get that checked, because that can be like a blockage in your carotid or something. So that's, hearing a heartbeat in your ear is not usually a good thing. Now, if you have an ear infection and fluid, you might also hear that. So I don't want you to think that, oh my God, I'm going to have a heart attack. But it's something that's not normal, okay? So I also, yes, we do amplification, hearing aids. They're getting really cool. They're rechargeable. A lot of them are rechargeable, Bluetooth compatible, so you guys could stream, you know, your iTunes or podcasts or whatever, phone calls right through your hearing aids. So I know some of you are wearing, you know, the AirPods. I don't have them, but what?
I like how you ask him, like, he's gonna know. He has a brand new cell phone that's been in his box for 8 months.
No, I don't want to wreck my
Because he doesn't,
hearing.
because he doesn't know how to use it.
I don't want to talk on it, so I wreck my hearing.
He's
She's looking at him like he's.
65 years old. He needs these right here.
Okay.